Good afternoon, everybody. Welcome to this Health Force webinar. We're delighted that so many of you are attending again and really appreciate the time you're taking out of your very busy days to take part in this. But we gathered from our last webinar that there were so many questions about NHS responders. We thought it would be really helpful to try and get someone from NHS England and from RVS to answer some of those questions directly for you. And we're delighted that we've got Ollie Young, who's the RVS project lead for NHS responders, and we've got Ashfa Slater from NHS England, and she is the public participation lead. So they're going to be here to answer your questions. I think we will also have our good friend from NHS England, Jane Fox, who's participating, who may choose to chip in, but she's certainly here to listen to what everybody's got to say. We've had, as you can probably imagine, lots of questions sent in advance of the webinar, and we're going to give those questions priority, and V will do her usual fabulous job of managing that. We want to encourage as many questions as possible, but clearly we've got limited time. So if you do have a question that you've been unable to ask, then use the raise your hand feature or type in the chat box your question, and we'll try and round those up at the end. And if we don't, we'll try and make sure that all those questions are answered in a note that follows this. I think Ollie will also talk to you about where there is a FAQs, question and answer session as well, so to help you. So I am going to hand over to Ollie, who's going to set the scene, give you a bit of an introduction before we go through the questions. So thanks very much and hope you find this useful.
Thanks, Mark. Hello, everybody. So what I'm going to do at the beginning is just to give you an overview of what the programme is. A lot of you have probably already seen details or heard about what the NHS Volunteer Responders programme looks like. So NHS Volunteer Responders is a new volunteer initiative supported by Royal Voluntary Service in partnership with NHS England and an application software company called GoodSound. So the service has been set up to enable volunteers to step forward across England to relieve pressure on the health service through the COVID-19 pandemic. The programme started less than 5 weeks ago and has been mobilised at tremendous speed. Within the first week of seeking volunteers to step forward to the programme, we received over 750,000 volunteer applications, which is phenomenal. So the key piece really about who can make referrals. So referrals can be made by health and social care professionals with a local authority or NHS email. And they can refer people into the scheme who are very high risk from coronavirus, where there's no local support available. For example, if they've been asked to self-isolate or shield, or if they're over 70 and have underlying health conditions. Vulnerable people are also able to refer in to the call centre if they are one of the people that are being shielded and receive the letter. And once a referral is in the system, it is then automatically matched to an on-duty volunteer in the local area to complete the task. And there's 4 key roles for the volunteers at the moment, and that will grow as time goes on. So the 4 volunteering roles that have been signed up to are the community response volunteer, which is a role that involves collecting shopping, medication or other essential supplies for people that are self-isolating and delivering these supplies to their home. We've got the patient transport volunteer, where the role supports the NHS by providing transport to patients who are medically fit for discharge and ensuring that they're settled safely back into their home or driving them to their appointments. We have the NHS transport volunteer, and this role involves transporting equipment, supplies or medication between NHS services and sites. And it may also be used to assist pharmacies with medication delivery. And lastly, we have the check-in and chat volunteer. And this role provides short-term telephone support to individuals who are at risk of loneliness as a consequence of self-isolation. I suppose the key point with the roles are that they are primarily centred around supporting the NHS outside of hospitals within the community. There is one additional role that will be coming very soon, which we are calling Community Response Plus. And these volunteers will do a similar role to the Community Response role, but more focused on patients with cognitive impairments or significant vulnerabilities. So those are the roles that have been signed up to, and the scheme is currently live. We are taking thousands of referrals per week, and obviously one of the ambitions is to increase that as time goes on.
In fact, I think those referrals have increased already to about 3,500.
Yeah.
That's great. Thank you so much, Ollie. I think Sally's has a bit of technical difficulty, so I'm just going to go with the questions with Ollie and Asfa now, if that's okay.
No problem.
So the first questions we have is about the Great Manchester Care Home. If you just give me a second, there we go. So an issue coming up a lot in Great Manchester is home care providers and care homes having to spend huge amounts of time queuing to collect prescriptions, groceries. They are hoping to increase their capacity to support people directly by asking for help from volunteers. Would this be something that the NHS Volunteers app could be used for? And many of the care homes now have an NHS email address, but how would you recommend home care providers referring into the service?
Yeah, so Ash will probably be able to tie in at the end of what I'm about to say. So private home care providers and care homes would not be able to complete online referrals. However, they would be able to call the support centre to log a referral. But with regards to specifically medication, the role of the NHS transport would be suitable for pharmacists to put on batch medication referrals on the system.
If you've got an NHS email address, as it says in the question, a lot of care homes do, that's absolutely fine. They can refer straight in. And then the system can support other care homes by phoning the contact centre, as Ollie said, or by going through pharmacists. If they use a particular pharmacist, the pharmacist can make the referral.
Thank you, Aswa. And what the second question we have is how to log referrals for NHS professionals.
So if you are a health professional with an NHS or Gov email address, you're able to log referrals on the online referral form, and we will after today provide you with that link if you've not already seen it. So an NHS or Gov email address, you don't need to register, and that's the key point. If it is your first referral, you go on the website to make the referral, and we do suggest that people read the instruction guide at the top prior to making that referral, because there is some really key information on there about how to complete it. You'll be asked to verify your email address, and you'll also receive a password, and that will then set up your account for future referrals to add into and to review going forward. And when adding a referral, the referrer is able to select the frequency of the support task. So we've got 4 options, which are one-off, daily, weekly, monthly. The referrer is able to select the priority of the referral. So if something needs to be done within 24 hours, we consider it a high priority. If it's over 48 hours, medium, or if it can be done in the next week, a low priority. It's probably worth mentioning that most referrals are being matched in less than 24 hours. So the priorities don't seem to be having an effect too much on that because of the quantity of volunteers that we've got. And once requested to complete, the referral is matched to a non-duty volunteer locally automatically. And the referral will also ask if the patient has any significant vulnerabilities or cognitive impairments. And these referrals will be held until our new Community Response Plus role has been activated, which should be soon.
Thank you. Sally, are you there yet? Okay, we can't have Sally, so I'm just going to go to the next question. Multiple questions requesting if we are able to supply demographic data, regionalised volunteer information statistics.
Yeah, so at present we're unable to provide data for specific areas of the country, and we are aware of the requests that are coming in and completely understand the requests that are coming in. We are working on improving that, and we are working on having a report that can be publicised a lot quicker and in a format that's agreed. I mean, just some of the key stats, just to give reassurance, is that, like I said, we've had over 750,000 volunteers register interest across England. So that has resulted in fantastic coverage across most areas of England. Just to give you an idea, the community response role We have 385,000 people that are signed up to do just that one role alone. And we are achieving a 99.67% matching rate of volunteers to client tasks at the moment. And our statistical team are working on the reports and data. We're also working closely with NHS England and Good Sam, the application around this area.
Perfect. And the question 4 we have is, what support and advice is given to higher risk volunteering groups?
So volunteers that fall under the high risk groups that include over 70s and those with underlying health conditions are still able to volunteer with us, but they're only able to volunteer with the check-in and chat volunteer role. And that, I mentioned earlier, is around short-term telephone support to isolated people, and the role doesn't involve leaving their house.
Thank you. And can RVS share what their Getting Started pack looks like?
Yeah, so all of our Getting Started guidance packs, which we have provided to our volunteers, are available on our new website, and the link will be shared following this. But just for your reference, it is nhsvolunteerresponders.org.uk, and that's got all of the latest guidance available.
Thank you. And number 6 we have it. What are the safeguarding and risk assessment procedures in place?
The safeguarding of patients and of volunteers is obviously paramount. Royal Voluntary Service have a safeguarding framework to support NHS volunteer responders. I'll go through all of the measures within the framework. However, the key ones are we have an internal safeguarding team working 7 days a week, picking up concerns from volunteers and patients and dealing with those immediately. All of the patients that are referred into the scheme receive a patient safety letter detailing what patients can expect from a volunteer and what to do if the volunteer experience falls below expectations, with a number for them to call. We have no one-to-one volunteer to patient relationships because of the way that Good Sam is, the way that Good Sam works as an app. It's a dynamic platform that matching available volunteers to tasks that are live. And I'm not, Ash, I don't know if you know the detail around this, but I don't think a volunteer can be matched to the same client more than once within a certain period of time.
Within 4 weeks.
Within 4 weeks. So I think that avoids that, that risk. All volunteers have an identification page within the app, which is their form of ID that they must show the patient, or if the patient asks. We have safe guidelines around payment and shopping, for payment for shopping and prescriptions. All volunteers sign an agreement, and we have a problem solving team that can support any problems. And all of the, like I said, all of the patients and volunteers are given access to our safeguarding email and phone number for the support centre.
Thank you, Ollie. Question number 7. There has been an incident when an NHS responder volunteer has asked a service user or client for their bank details. Are we exposing vulnerable people to financial abuse, exploitation?
Yeah, so unfortunately, due to the huge quantity of volunteer responders that we have, we're unable to solve issues of non-conformance or safeguarding issues. However, volunteers are provided very clear instructions within their Getting Started packs to not take bank details or cards from patients that are requesting payment for groceries and shopping as part of the community response role. All clients, as said earlier, are provided a patient letter which also details that they should not be giving a volunteer those sensitive or confidential items or information. And if there is any breach to that, then our safeguarding team will be involved and they need to be alerted.
Thank you. Question number 8. We have been actively recruiting to a pharmacy driver's volunteer role for collection and delivery of medication for our cancer patients, and have tried to recruit from NHS hospitals, but to date we have had no one offering, in spite of our understanding that local volunteers have signed up for this role through the scheme.
Yeah, so in response to that, and going on my previous statistic of 99.67% matching rate, we believe that that particular issue that was raised definitely needs to be looked into, because it's unlikely that volunteers aren't available, and it's more likely that the referral may have been input incorrectly. So if there is any concerns about a referral that has already been made, we are advising that referrers contact our support team to look into the matter.
Thank you. Question number 9. So driving patients to appointments, how will social distancing be managed?
So it's important to remember that with regards to the referrals, healthcare professionals that we're working with will not refer individuals for driving support if they could or have got COVID-19. So these individuals will continue to be supported by other options, but not by our volunteers. So our volunteers will only be supporting those who need to attend their routine healthcare appointments, some other infrastructure can support on transporting patients with COVID-19. We do have guidance on the patient transport role that can be found on our Volunteer Responder website. And there is guidance around cleaning cars prior to the patient going in and after. And there are other guidelines that we follow with the government around that.
Thank you. And question number 10 we have here for Asfer. Concern in inconsistency in receiving timely updates on progress with NHS Responders Initiative, how to refer. Information gets through eventually, but how can this be improved?
So we have been aware that this has been a bit of a problem, and we have now focused all of our information going out through the NHS Volunteer Responder website as a way to get around some of the issues that we faced. We're constantly working on improving updates and progress within the programme. And with colleagues within the system, we are working with them to make sure that we can get consistent, effective messages and an approach to sending out updates and progress out to their different parts of the sector. So we're looking at using health journals, different webinars with specific groups like GPs, primary care colleagues, social prescribers, etc., and also other forums and publications for how we can actually promote the service. We've seen that we've been in a phase where typically people have wanted to ask a lot of questions, like we're having on the webinar today, but we are also seeing that we're now there's now an increase in referrals that are coming through. So as Ollie said in the introduction, there was 1,000, now we're seeing about 3,500 coming through on a daily basis. So things are picking up now.
Perfect, thank you. So what training will volunteers undergo? Ollie, can you answer that?
Yeah, so all of our volunteers will, as we've said, receive a Getting You Started guidance pack, which is available on the NHS Volunteer Responders website. And there's very specific, clear and detailed guidance which will enable them to provide support safely. It's worth noting that our volunteers are there to provide a preventative service to isolation and shielding, and not a treatment or care delivery service for those with significant vulnerabilities and issues. We have unfortunately seen some referrals that are requesting volunteers to do the more treatment or care sort of type roles, which is not appropriate for this scheme. As I've mentioned, we are also finalising guidance for our new Community Response Plus role, which will support with significant vulnerabilities and cognitive impairments. And we are going to be reaching out to all community response applicants to ask them if they would like to consider this role. And if they do select that role and are supporting people with significant vulnerabilities, they will receive some further guidance and signposting to support them to do that.
Perfect, thank you. And how can people track whether their referral have been completed?
Yep, so after the referral's gone in, after your first one, you are sent a link which is sent to your email address, and you will also receive a password. This will then become your login for you to be able to view future referrals and also amend and cancel existing referrals if needed. But it's worth stressing again that we have got the contact support centre that can support with that if there is any issues. But it's much easier if referrers can manage that themselves via the portal.
Perfect. And to go with that, when they put in a repeat referral, how do they know if this has been matched to a volunteer?
Yeah, so unfortunately at the moment with the system, it doesn't tell the referrer when a repeat referral has been met after the initial match. However, if your task has not been matched or completed with a volunteer within 3 days, the referrer will be notified via the portal. We are working with the app developers at the moment about improving that so that people who have put repeat referrals can see more up-to-date information. But like I said, they will be notified if that volunteer hasn't been matched with the patient in 3 days.
Thank you, Ollie. And are the responders sufficiently trained to be able to support mental health service users who are isolating at home and may have heightened anxiety?
Yeah, so NHS volunteer responders isn't designed to provide this level of support necessarily. However, if a volunteer comes across this, within the guidance, it does contain specific guidance around supporting individuals that are living with poor, low mental health. If a referrer does know that someone is living with low mental health, they should refer them to other local provisions which can provide suitable ongoing support rather than the check-in and chat volunteer role.
Thank you. And is the app the only way of requesting support? Is telephone support available? And if so, is this a secondary option or something we can use to support our system coordination?
So we're advising healthcare professionals to request referrals via the online referral form. The benefits of doing this, as mentioned earlier, are that the referrers are able to cancel, change, review their referrals live, as opposed to phoning the call centre. The support centre will also be able to take referrals, however they will advise on the phone that healthcare professionals and local authorities use the website if they're able to.
What information is given to volunteers regarding local established voluntary sector services available to local residents?
Yeah, so this is quite an important question because it came up quite a lot prior to this webinar. So NHS volunteer responders are not provided with the information on locally established voluntary sector services that are available to local residents. However, the NHS programme is not to duplicate or replace existing voluntary support provisions already in place, but more so to enhance and complement them. So healthcare professionals will need to decide how best to coordinate required referrals, whether that's through the NHS Volunteer Responder Programme or other voluntary local support groups. We do remain in constant discussion with other third-party organisations, including the Richmond Group, and I think it's an ongoing dialogue. Ashra, I don't know if you've got some more you want to add.
Yeah, this is something that's become quite a focus of what we're doing at the moment, and so our attention is quite acutely focused on this at the moment. So we're working with SCPs and ICSs and also within our regional structures, looking with the aim of that is that we limit overlap of resources in local areas and we ensure complementarity. There will be further work done in this area, and hopefully when we can get more data available through Good Sam, we'll be able to enhance that aspect. So it's something that we are also very aware of and we're working on it at the moment.
Thank you, Asfa. The next question is there a follow-up system in place for those clients who received a one-off service, or would they need to be re-referred?
So if a referral has been submitted for a client as a one-off, the referrer will need to complete another referral. If a volunteer supports an individual that has been selected as a one-off and believes that they require further voluntary support, they are able to call the contact centre, who will be able to, in result, contact the referrer to amend that referral to a higher frequency, whether that's daily, weekly or monthly.
Thank you. And could you explain the system in place regarding confidentiality of client information?
Yeah. So nothing confidential or private is shared between the programme and the volunteer. When a request is sent out to a volunteer via the Good Sam app, it will only share the client's name and address. Within the guidance packs that all of the responders receive, it details clear expectations around confidentiality and data protection. And within this guidance, there is also a clear volunteering agreement which all volunteers must abide by as part of their role. And within the guidance, it also provides information to protect the volunteer, and all volunteers are asked to withhold their number when contacting the client to protect themselves.
Also, for the check-in and chat, the volunteer won't even receive the address because they don't need it. So only the information that they absolutely need to undertake the role is provided to the volunteer.
Yeah, thank you. So what documentation is maintained and where is it stored?
So there's two types of data which is stored. We store volunteer information and client referral information. So all of the data is held in servers secured by the Good Sam application. It's not accessible by RVS, NHS or Good Sam unless there is a safeguarding concern. Volunteer information that we hold is what they input on their application form, and for the client, whatever the detail on the referral form and their status. And we will delete any data that is requested by either a volunteer, referrer or client when they call the support centre, and we'll completely delete that from the database. I won't go through the specifics of the regulations that we're following. You'll see this, but we are following some regulations in terms of ISO and TLS in terms of how we store our data.
Thank you, Ollie. Does the GP practice get to know every client that has been referred, if from other sources?
So the support centre are able to confirm if a referral has already been made for a client, if a GP practice requests this. So if a healthcare professional phones the call centre to check if there is already a referral on the system for a particular client, they can confirm this. If patients want to self-refer via the support centre, the call handler will check the system to make sure that a health professional hasn't already put a referral in. And in all cases, the referrer will be notified of any changes to request. So if a patient phones up and asks for their check-in and chat to be expanded to the community response role, the referrer in the first case will be alerted of that request.
Thank you. And can you clarify the liability?
Yeah, so Royal Voluntary Service liability insurance policy covers up to 2 million volunteers. We will only accept liability if the volunteers are obviously following the guidelines and boundaries that we have set.
And who is the responsible organisation for the volunteers then?
That's Royal Voluntary Service.
Thank you. And how are volunteers mentored or supported?
So all volunteers are able to call the NHS Volunteer Responders Support Centre for any support or guidance. And we are seeing a lot of numbers of that happening at the call centre, which is encouraging that people are using that number. We also have, as mentioned earlier, the NHS Volunteer Responders Portal. And this has really useful information and details for volunteers, which is regularly updated.
Thank you. Next question is, are there any plans for social care employers to access potential volunteers?
I don't know if you're better positioned to answer that one, if that's okay.
Yeah, that's absolutely fine. So yes, it is open to social care employers. If you have a local authority email address or access to one, you can do it simply through that referral route. It's also open to housing teams within councils and link workers as well. If you are working in the social care sector, but you don't have access to an NHS or .gov email address, you can phone in through the contact centre. That might take a little longer because you would need to be verified by the individual at the other end of the phone from RVS, but valid referrals can be accepted.
Thank you, Aspa. Should a single nominated person set up an account on behalf of each organisation?
We're leaving this completely open to each organisation to decide. So whatever suits the referral organisation. We have seen in practice that if an organisation has a single nominated person, it can be more effective in terms of managing and reviewing all of the referrals.
Thank you. So what happens if a task is not completed by a volunteer?
Yep, so as mentioned earlier, the referral task will remain in the system 3 days to hopefully be matched with a volunteer. And as also mentioned, we are achieving currently a 99.67% matching rate. So we're not seeing any issues of that currently. If it's not matched after 3 days, the referrer is notified via the referrer portal.
Thank you. Security of medicines when collected on behalf of individual patients or transported in bulk between sites. DBS checks for those handling medicines. Aswa, can you answer?
Yes, I can. So we've had quite a lot of discussion with pharmacy colleagues and responding to comments from the pharmaceutical sector. And we've reached a point this week where the General Pharmaceutical Council and the Royal Pharmaceutical Society have issued a joint statement about the use of NHS volunteers to deliver medicines in England, saying that they do support that. And I do believe that there is an article that's gone into one of the pharmacy sector journals today as well, also saying that. So those tasks can be undertaken by a few roles. They can be undertaken by a community responder for an individual. They can be undertaken as part of the NHS supplies, transporting of supplies, but also as part of the patient transport volunteer role, which is the enhanced DBS checked role. There are different rules at the current time around DBS checks that the Home Office has issued. And the liability for the transportation of pharmaceuticals, pharmacies won't be held liable for what happens if they use the volunteers in the way that the programme has been set up.
I see. Thank you, Asfa. And how long will the program last? And what will happen to the volunteers at the end?
Yeah, so at present, the program is scheduled to continue for the rest of this year, in supporting clients through the COVID-19 pandemic. Obviously, as we've discussed, over 750,000 people stepped forward. We're hearing reports that this is the greatest volunteering step up since the World War II. So, we've obviously got to capitalise on that. There is no definitive plans on what will happen next with volunteers at the end of the programme. What we can say is Royal Voluntary Service and NHS England are having active conversations with this currently, and various options are being explored. And it's also worth noting that we do abide by data protection rules on all of our decisions. Ash, I don't know if you've got anything else on that one.
Only that the programme's been up and running just for a week. So, volunteers have been active only for a week, although it does feel like longer because it's been in the public domain for longer. Also, that the programme was developed at scale and pace to meet a certain need. So some of the questions, for example, this one in particular, what will happen to the volunteers at the end, it's really very early days. That doesn't mean that we're ignoring it at the moment, but we're just not at the stage where we've got a clear way forward. And I think what volunteers might be used for and how they might be used best going forward is probably still yet to emerge in terms of the picture around the situation that we're in. So yeah, that's it really in addition to that.
Thank you. And we have some extra questions here. The first one is, so how is the referral criteria and referral process being publicized to staff locally? Is this reliant on individual systems locally, or is it being coordinated nationally?
So it's a combined effort, actually. So there is some national coordination, but there is some local coordination as well. As you can imagine, coordinating on a local basis is not simple because different local structures have got are all different to meet local needs. So some of it will take a little longer than others, but it's being done in a combined way.
Thank you as well. When you refer through GoodSam, you can't specify between pharmacy or food shopping. Can this be resolved?
Yeah, so at the moment, the role is community response, which encompasses both of those activities, both shopping and prescriptions. There isn't a way on the form to separate those for a very good reason, that there is a lot of clients that will require both. So it's up to the volunteer when they make contact with that patient to determine what is the requirement, whether that is medication or shopping.
Thank you. Next one is, if there is a big need from an organization, say an NHS trust, needs to deliver medication every day, 80 plus deliveries to patients, can they bulk order volunteers, 20 over 30?
I can answer that if you like. Yes, they can. And they can do it through so if it is a bulk order, is this for supplies or for? for supplies, did you say?
Yeah.
Yes, they can. They can put that order through for the NHS Transport Volunteer, and if they mark it up as daily, they will get somebody every day.
Perfect. Thank you so much, Afa. And we got like 23 questions in our Q&A chat box. Thank you so much, everyone, for contributing. I'm just going to go through them now with you. Oli, could you see your Q&A chat box?
Yeah.
Yeah. Right, so we can go from beginning.
I'm on the phone, so I can't see a chat box.
I will say it out loud then.
Okay.
So, question from Stephanie Mooney. How are you looking to evolve the roles in the future?
Yeah, so Ash will definitely probably tie into this. So as I've already discussed, we are looking at bringing in a very new role shortly, which is the Community Response Plus role for patients with cognitive impairments or significant vulnerabilities. There are conversations that are happening at the moment about additional roles. Ash, I don't know if you can say anything more on that at the moment.
I mean, we're at early stages of this and we're still thinking through them, but we're thinking about whether there's a possibility for a role that could support primary care in a different way. So, for example, somebody in a GP practice that would be allocated to them for a period of time, or maybe in a pharmacy that could be allocated to them for a period of time. They would need different types of DBS checks, etc., but they then could be deployed in different ways to support point of care. But none of this has been resolved yet, so what I'm sharing with you are ideas at the moment that are not fully formulated.
Thank you as well. Next question is from Stephanie as well. So how is it linking in with volunteers being coordinated by VCS and local councils already?
So we have started this conversation and we're looking at how we can link them into local resilience forums. We're also talking with SCPs and ICSs about how we can link them in across those groups. We are hoping that we are going to be able to link between voluntary sector organisations and this programme, but we're awaiting legal clarity on some of those issues, but we're hoping that they will be resolved next week. So a lot of these conversations are in train at the moment and we'll be able to give you clearer information on them going forward.
Thank you. And question from Judith. On the app, the form only has space to enter one address where the service is required, which could be challenging when the request is for example, prescription delivery to a rural address. Second address and all further details would need to be entered in 3 text boxes. Would this be updated? So
just there's a couple of points on that. So some of the referrers will probably remember we actually did have a free text box at the beginning stages of this, which we had to remove because it was open to abuse, where there was sensitive information that was provided in there which we didn't want obviously volunteers to see. We are looking at improving the address function. I don't know if there's a question later on about that. When a referral is made, because it's using a Google platform, when an address is inputted, it can sometimes skew it a little bit. So we are working with the app developers to improve that, but we are where we are at the moment. In terms of the prescription delivery to multiple addresses, that sounds to me like the NHS transport role, which would probably cover that off if that was the role they selected rather than an individual community response role.
Thank you, Oli. Next question, also from Judith. Do you know how many volunteers are now active on the app? We know that 750,000 recruited. Are they all through recruitment?
Well, I haven't got the definitive numbers on that. Not sure how to answer that at the moment. Ashra?
Could you, the phone was cutting in and out then. Could you just repeat the question, please?
Yeah, of course. This is a question, I think, Asfa, are you? Yeah. Do you know how many volunteers are now active on the app? We know that 750,000 has been recruited. Are they all through recruitment process?
So no, they weren't, or they. identity checks and DBS checks happened for those roles that required a DBS check. So there aren't necessarily 750,000 people active. I don't have the final numbers of that, but there are, I mean, a significant majority of those people are active. When and for how long they're active at a time depends on the volunteer can choose to put the app on. So they're not all active every day. They choose when to make themselves live and available.
Yeah, that's understandable. So this is a question from Gillian. How can hospices use NHS responders offer? Will Ollie be able to answer this?
Ash, I don't know if you've got any more detail on this one.
Well, when we're working with different colleagues in different parts of the sector, we're asking them to think about some of the day-to-day issues that they're facing now, and actually is there a different way that they could and because of the constraints that they're facing within their organisation, are there things that they can use these volunteer responders for? So it could be around collection of medications from pharmacy, it could be collection of equipment or material, etc., picking them up from a depot and bringing it back to the hospice. It's really up to hospices to decide how they could use it, rather than us telling them how to use it. I think our offer is there. You can use it creatively, and we're encouraging people to do that. Yeah.
Perfect. Thank you, Aswa. Next question from Maria. Should the volunteers carry medication if they're not checked? What about controlled drugs? How is it being governed?
So there are there are some drugs that they can't carry, that come under controlled drugs. That does come in within the guidelines. The other governance around this is if a pharmacy was to request a volunteer, or even if an individual was, and it was to collect pharmaceutical medication, you can track that person on the Good Sam app, so you can see whether that action's been completed. If an individual has called the volunteer and asked them to collect something, they will know if they've received it, and they can report that in if they don't receive it. This is only a service that has to be used or is available to use in addition to pharmacies' regular drivers. So for example, if a pharmacy has drivers that are available Monday, Wednesday, Friday, they can use this service in addition to that. If they're not comfortable sending some medications out via the volunteer responder, they can choose to do that through their regular drivers and use these volunteers for additional capacity to supplement that.
Yeah, thank you. Another question from Maria. How are volunteers linked to local CVS provision?
So as we said earlier, the NHS volunteer responders isn't to replace or duplicate, it's to complement, and really it's up to the referrers how they best do their referrals, whether it's through the scheme or whether it's through the local CVS provisions. Obviously we've got very defined roles as part of the NHS volunteer responder programme. There is likely to be duplication where some of the local CVCs will have similar roles, but we're not there to compete. It's a case of the referrer making that decision of how best to refer in patients.
And it's not unlikely that an individual might be volunteering for different people at the same time. They're not exclusive to us, so they may well be volunteering with the responders program, but they might also be volunteering locally as well.
Yeah, perfect. The next one is from an anonymous attendee. You mentioned that referrals for those with cognitive difficulties is awaiting this next part of the process. What happens with those referrals currently if they are urgent?
Yeah, so we made a change earlier this week on the referral form for the community response role, where a referral that required a community response role had to tick whether the patient that we're referring had a cognitive impairment or significant vulnerability. So since that change has been made, we are currently holding the referrals in the system prior to the new community response role, plus role being activated. We are sending an automatic email to all referrals that tick that box to advise them that there may be a delay and for them to consider alternative arrangements in the interim if it is an urgent request.
Thank you. This question is from Ian Jones. How are you integrating with established local systems that have developed solutions through the STP plans that local NHS and social care have already put in place?
So I think this comes back to what I was saying earlier, that these are all very live discussions, and different STPs and ICSs have different structures. Colleagues met with a number of them earlier in the week, and they have requested that they nominate somebody that will be the link person with colleagues of mine in my team. So that's how that will be taken forward. They will nominate somebody, we will link with that nominated person, and we'll work with the nominated person to complement and add value to what they're already offering.
Thank you. I think this question might have been covered, but correct me if I'm wrong, okay? This is a question from Mandy. Is there any thought about continuing this scheme in the future and working with hospital trusts and their volunteers for these valuable roles?
Yeah, so as we said at the end of the original Q&A, I think these conversations are obviously active and they will progress as we go on through the programme, but it is still incredibly early days. It feels like years since we started this programme, but it was literally a few weeks ago that we started it. So.
That's right. The next one is from an anonymous attendee. On a Good Sam app, as a responder, being on duty seems to equate to volunteering hours despite no task being undertaken. How are volunteer hours being reported on to avoid inaccurate statistics being provided?
So we are working on reports that will be able to report on tasks that are completed rather than hours that a volunteer responder has clicked on duty. That's probably the more valuable statistic. Although it's great to see volunteer responders on duty for hundreds of hours, the real key statistic is how many tasks they're completing, and we are working in the background to try and get that data.
Thank you, Ollie. Next one from Joseph. What measures are in place, example PPE, for the protection of volunteers and patients in transportation roles for those without a bulkhead? Example, a normal car without separation of driver and passengers.
Okay, so we're updating that guidance as soon as we get guidance from our NHS England and PHE colleagues. We are not set up as a service to transport COVID positive patients, although, of course, there is the risk that somebody might be COVID positive in the general population. So the service is set up to provide home from hospital transport where that's needed, but the preference for that is friends and family and other transportation that the hospital trusts already have in place for that sort of provision. And then we come after that, and then ambulances. In terms of transporting patients to essential healthcare appointments, there is guidance on the volunteer responders site at the moment that talks about how you should clean your car before and after each patient has used it, etc., etc. We are in the process of updating that to include the wearing of masks. What we are trying to bottom out at the moment is the supply of that PPE equipment. So we haven't updated the guidance on the site with that information as yet, because we need to bottom out some of those issues first.
Thank you, Aswa. The next one is, how will we know as a local authority if other services have referred the same resident in, for example, social care, NHS? We would be able to see a data list of our borough so we can ensure people aren't being missed.
So I'm just trying to understand that question. So that's if we check that person has already been referred into the scheme by another. Asha, have you got a better answer Probably I am.
No, I think a lot of the questions around local data are being worked through at the moment. Yeah, so we don't have we don't have a response to that at this moment in time, other than the fact that we know that some of these things are live issues, and we're trying to work out how to get that data with Good Sam.
Thank you. The next question is from Joseph. Is there be any vetting of volunteers' competency for the community responder plus role? For example, experience of support mental health or cognitive conditions?
So the short answer in regards to competency is no. We don't do any tests or anything like that to determine whether a volunteer is capable of doing the role. But as we've mentioned, we provide very detailed guidance on the role. And with regards to the Community Response Plus role, we are requesting that a volunteer can only do the role if they have an enhanced DBS certificate clearance. So we have got that safeguarding measure as well. I don't know if you've got any more, Ashford, on that one.
No, I haven't.
Thank you both. Next one from Katie. Can you explain in detail what the recruitment process is? I am concerned that the responders apparently have much fewer checks than our voluntary sector partners, yet are being potentially directed to the more vulnerable people. For example, no reference, no DBS for most roles, or no could be handling money, getting medication for people.
Yeah. Sorry,
So the roles that they're doing, they shouldn't have any contact with people anyway, other than the patient transport role. So they should be social distancing at all times anyhow. We are following all the latest guidance around safeguarding. So we are following the latest guidance from the Home Office around DBS checks, and DBS checks are just one element of the safeguarding processes that RVS has put in place. As Ollie said before, there is a whole safeguarding framework that's being followed, and there is specific guidance that is available around paying for shopping and handling money. On that point alone, we don't have the ideal solution because there isn't the ideal solution. So what we've gone with is the best fit solution that we can use at this point in time. We work very hard with the different consumer bodies to try and find a solution to that. And the pace at which this needed to be put in place kind of dictated what we've gone with in the end. So we have updated information around that, and we've put in place additional communication to recipients of support to help safeguard them as well.
Thank you. I think the next question is how did the public know about the service? But I think it's more about how the public can access the service as well.
Yeah, and we're going to be improving that communication. I think we've been quite fortunate because it's been such a high-profile program in terms of program being mentioned on the daily coronavirus briefings, that we haven't necessarily needed to do a huge amount in terms of alerting the public about the scheme, but we will do more going forward.
Thank you. Next one is, will there be higher level checks for those community plus volunteers you intend to come?
Yeah, so as mentioned, an enhanced DBS clearance is required for that role.
Next one is from Yvonne Thompson. So how will people who have disabilities be able to access the service if they are unable to use computers and phones?
So in terms of patients that require the service, haven't got computers or phones, the only route would be their health professional referring them in. There wouldn't be another
health or care professional. Yeah.
From a question from Anna, are volunteers being given advice or access to PPE?
Well, most volunteers don't need PPE. It's only in the patient transport role. And that's something that we're working on at the moment. But actually, we've had far fewer people accepted into that role, volunteer and accepted into that role at the moment. And it's the one role that is being used. It's not being used as frequently as the others as it is, and we're working on that.
Thank you. I'm conscious that we're going to come to our end of our session very soon, so we will try to go through as many as we can, but if we can't go through all of them, please bear with us and we will try to get back to you later time. Next question we have is from Joe. All on 4 or 5 roles DBS checked. What other checks are done on volunteers?
So no, not all of the roles we require a DBS clearance. It's only the patient transport role and the community response plus role. But all volunteers that signed up to the scheme required a form of identification, and there were set guidelines around that they had to send in, which was verified by our ID checking team. So,
next one is from Kay. If a referral has been made and we find it has already been completed by a neighbour, can it be cancelled?
Yeah. So either calling the call centre or the person contacting their referrer to cancel it. Yeah.
Thank you. The next one is there any analysis of volunteers who are not receiving tasks or accepting them to ensure engagement of underutilised volunteers? Example, how are tasks being equitably distributed? So I think it's about analysing, isn't it?
Yeah, and so same answer again. Unfortunately, it's a case that we are working on the statistics to improve things, but the app, as we've said, is designed that it does distribute tasks equally, so that the same volunteer wouldn't necessarily have the same task of the same patient within a 4-week period.
And it looks for volunteers based on their location. So it'll go to the nearest available volunteer, and then the radius goes out a bit further, and then further out from that. I think also in terms of the bit of the question that was about keeping volunteers engaged, RVS is looking to develop a newsletter that will go out to volunteers on a regular basis. So that will help enable ongoing communication with volunteers as well.
Thank you. Next one from Kate. We are hearing concerns about whether you can enter multiple requests at once to save healthcare professionals time inputting loads of separate referrals. How could this be done?
There's work going on at the moment around looking at how those bulk referrals can be put into the system. So that would be a change to the referral form. As you can appreciate, it's only a week in, and we've been getting this scheme up and running with RVS and Good Sam, and then just ironing out some of the initial teething problems. Now that seems to be starting to settle down a little, we're looking at making some of these enhancements. So one of the enhancements will be a referral form where you can make bulk referrals.
Thank you. Next one we have is, we're having concerns about shielded patients asking for support, both through the national portal and via local helplines. And although someone getting help twice isn't bad, it is if it removes the help from someone else. We need to have data shared so that we can check how our shielded patients are being supported locally.
Okay, we can certainly consider that.
Yeah, thank you. Next one is from Grant Weston. For those volunteers using their own transport, what is the situation on insurance status?
So there is guidance within the the patient transport and the NHS transport volunteer role, and there are changes. I couldn't quote it to you, but we can certainly answer this with some text. There are changes that have been made to insurance to enable volunteers.
We've got a link with the British Insurers Association that confirms that the NHS volunteer responders are covered by most major insurance companies, so we can find that link and send that out. Yeah.
Thank you. They're the words I was looking for.
The next one we have is, if a system decides to use local schemes and the national volunteers are therefore not used, how will potential frustrations about not being placed be managed? So I think we're managing expectations, isn't it?
Yeah. Well, I think in the recruitment, volunteers were always aware that this would be something where they would be called on if there was a need. Also, as I said before, there is going to be a newsletter that will go out to volunteers, and it will, as I understand, one of the things that will be talked about are other things that are available that people could volunteer for. So we are aware that there are some frustrations amongst people who are almost anticipating that they would be on call every day and receive, calls for support every day. And the reality of that hasn't materialized for them.
Thank you. So the last one is a comment from Jen. The focus of the volunteer support is practical currently. This is great and necessary, but is there a way that the volunteers could be used to help people keep focus as time moves on and the impact of social distancing over a long-term takes effect? A community resilient roles, perhaps?
I suppose it definitely could be considered when the scheme evolves over the future, how we best utilise people through the impact of social distancing. Yeah.
Mm.
Thank you. So I realised that we are at 1 o'clock now. So sadly we have to end the session. I realised that we have so many more questions. So I definitely will ask Oli and Asfa to reply to later, and we will share all of the question and answers and a recording of this webinar on the Learning Zone. So make sure you visit the website regularly to get the updates. Mark, would you like to say something?
Thank you to Ollie and Ashfa from all of us at Helpforce and everyone who's taken part in this webinar. We had over 100 people listening, so it's obviously clearly a really important topic. It's been a phenomenal effort to try and mobilise 750,000 volunteers. Having spent 6 years as chief exec at the old WRVS 15 years ago, I can fully appreciate the challenges that you're facing, and more power to all of you, and anything we can do to help, do today. But thanks so much for answering all the questions. Hopefully everybody's found that helpful. And as V says, we will circulate details of the answers to the questions which weren't answered. But thanks ever so much, everybody. And look forward to speaking to you at the next webinar. Thanks very much.
Thank you so much, everyone.
Thank you.
Bye.
Thank you.
Thank you.
Bye.
Bye. Bye.